extension tubing is primed, hands are washed, gloves are on, and my dressing has initials, date, gauge, and time. At this point, I'm going to apply the tourniquet 4 inches above where is planned, like that. I'm going to palpate for vein. Vein is found. I'm going to release the tourniquet. And at this point, I would clip any hair in the area if that was needed. Now I'm going to cleanse the area with chlorhexidine for about 30 seconds using a circular motion. After the 30 seconds, I would let it completely dry. And then I am going to put the tourniquet back on and get the needle ready. Kind of came off, sorry. And at this point, I am going to stabilize the vein. And I am going to go in at a 10 to 15 degree angle. At this point, I would wait to see flash. I can see flash, so I'm going to go in a little further until I see the catheter flash. Now that I see catheter flash, I am able to push the plate off of there. And at this point, I would release the tourniquet. Now I'm going to occlude the vein and push up here, making sure that I am above that tip. Now I'm going to withdraw the needle. And at this point, still occluding the vein, I am going to take the cap off of the extension tubing, pull back, and put it in. And then I am going to use my thumb to screw that on. Now at this point, I have a closed system, so I can pull back on my syringe, pulling back to make sure that I have blood return. I see blood return. So now I am going to flush slowly. And there it is. Okay, now I'm going to apply my dressing. Making sure that it covers completely. Pushing around. Now I can remove the saline. Lock the extension set. I'm going to peel this dressing off. Holding down so that it doesn't lift. Now I'm going to make a J with the rest of the tubing. making sure not to go over the site. I'm gonna put my initials, date and gauge there. And at this point, I would get rid of my sharps and everything, wash my hands, put on new gloves. Now it's time to remove the IV. So I want to make sure that I stabilize where it starts, and then lift here until I hear a pop. And now I can slowly start grabbing. There's the pop. Now I'm going to slowly start grabbing all the way around, making sure to stabilize the whole time. And at this point, you can see it's really sticky, so I can grab an alcohol pad, and while stabilizing, I can rub underneath to get rid of it. Still stabilizing. Stabilizing. Making sure to get underneath as well. While still stabilizing. And at this point, everything is lifted. So with my non-dominant hand, I'm going to take fingers right here, making sure not to touch it. And I'm going to hover over, and then I'm going to, sorry, it's still sticky on the straw a little bit. Stick into the blue pad. At this point, I'll hover over, pull out, and push down. I would hold it here, make sure that they are not bleeding, and then at this point, I am able to roll up the sides, like that, and grab tape and put it over. And stick it in my glove again.